Are you a physician looking to take your own profitable medical expert witness practice to the next level? MedicalExpertWitness.com is the ultimate program to learn how to brand yourself as an expert witness and get yourself seen. Building a reputation in the field from scratch has its challenges, but don't let them hold you back.
MedicalExpertWitness.com understands what you are facing, as they were once there too. In fact, 10 years ago, CEO Dr. Jordan Romano started his own consulting in the medical malpractice space. His experience has included providing expert witness testimony, reviewing medical records, and analyzing complex medical cases. Dr. Romano has become well-versed in the intricacies of medical malpractice law and has worked on cases for both plaintiffs and defendants in nearly every state in the U.S. And now his company provides medical professionals with the tools and support they need to supercharge their career as a medical expert witness. Sounds great, doesn't it?
Absolutely. Just imagine having the support you need to brand yourself as a medical expert witness too. Now that's powerful. So what are you waiting for? Visit MedicalExpertWitness.com today and gain access to a mentor who can connect you with attorneys in need of your specialized knowledge, expand your network, find new cases, and watch your business thrive.
Finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Drs. May and Tim Hindmarsh.
We have Martha Rosenberg back with us again. Just a delightful person, a great investigative journalist and writer. She has her a reissue of a book she wrote with lots of new updated information called Big Food, Big Pharma, Big Lies, coming out at the end of the summer that can be pre-ordered from Barnes & Noble. So welcome, Martha, back to BS Free MD. We can't wait to get into this topic of how pharma has infiltrated the military or the military has infiltrated pharma or whatever, but it is obviously a very ugly marriage that has gone on here.
Well, it is. And I cover it quite a bit in the book. We heard a lot about the suicides of our soldiers. And we also know, at least I'm sure you guys know, that the SSRIs, which were rampant, are linked to suicide, especially in the young age group. So, I mean, what is surprising about that, you know? And I have some statistics here. In 2008, which I think was still during the wars, or maybe right after the wars, 578,000 epilepsy pills were given to our troops that 1 year, okay? 89,000 antipsychotics were given to our troops. And, you know, a TRICARE is the military insurance. And according to my records here, between 2005 and 2009, half of all TRICARE prescriptions were for antidepressants and epilepsy drugs. And, you know, the epilepsy drugs like Topamax and Lactamol, and they call them mood stabilizers, I think. But you know, so what we had was really a pharma battlefield, okay? And, you know, you talk about, or we've spoken about push-ups and how fast you run a mile being dropped as standards. But what I also discovered in writing my book is that if somebody, like so many of our young kids, is on an ADHD medicine or an autism, they're still allowed to enlist. So you had people enlisting who were already on drugs. And then here comes Uncle Sam, and they're like, well, you know, you're nervous, you're depressed, here's an SSRI, here's an antipsychotic, here's a mood stabilizer. So we had, and I might add here, Tim and May, that my sources on this are either Military Times, Army Times, or the government itself. I don't take anecdotes. I mean, these are like documented sources. And Military Times and Army Times, which are pretty close in content, really exposed how drugged our soldiers were. They said 1 out of 6 of our soldiers was on psychoactive drugs. And I just found that shocking.
Wow.
They're
I was just
I
about to
know,
ask
I
that,
know.
just to pop in my thought in here before I forget it, because when you were quoting the data from TRICARE about the SSRIs, the antidepressants and the mood stabilizers, the anti-seizure meds are used for that, antipsychotics. I was wondering, is that in active duty people, or is that in all military, including, people that are out of active duty and now have, PTSD, etc., that are being treated? So I'm assuming that was in all. Yeah.
Well, that's a good question. I have to. I certainly it's not veterans. It's certainly active duty, but I think it was actually our deploying troops at Fort Bragg. I'm looking at my other computer here. At Fort Bragg, there was 5,000 soldiers on antidepressants, which is pretty shocking. Okay, and at Fort Hood, there was 6,000 soldiers on SSRIs and 1,400 on antipsychotics. And those are the bases that would ship out to, our war zones. So I think we're talking about active duty. And I think but one thing that I found very shocking, and of course, I'm no friend of Big Pharma, but they did a study of when the suicides were making the headlines, which they're not anymore, and they should be because they're still high. I'll talk about that in a minute. But the government did a study of who were the suicides, and 1/3 had seen action, 1/3 had gone there and seen no action, and 1/3 had never deployed. Okay, so what does that tells me? It's the drugs. Okay, I mean, if you've never even deployed but you're on an SSRI and then you're a suicide, you certainly can't blame the war. Okay, so I was just shocked at how medicated our troops are, according to Military Times, Army Times, and even our own government. And as I said, Fort Hood, Fort Bragg, and TRICARE are 3 sources of just shocking. And they, I think it was Military Times mentioned not just one drug like an SSRI, but cocktails. Now, why is a 21-year-old who's supposed to be physically fit, So as I began researching at this first book, Meeting with the Families, naturally I looked at the administrators in the military, and I found, they do CMEs, continuing medical education, and I was just shocked at how they unabashedly would say, I'm funded by AstraZeneca, I'm funded by Eli Lilly, I'm funded by Merck, I'm funded by Pfizer. And I was like, what? And now I have to say this, as they've hidden all those conflicts. You can't find them anywhere. I found them, but they've really shed those COEs, we call conflict of interest, for the very reason that it impugns their credibility. When I wrote the book in 2012, a big issue back then was the antipsychotics. Seroquel was it was one of the drugs that these doctors were pushing, or these administrators were pushing, and they were also paid by the pharmaceuticals to push it. And since then, other drugs have become more popular. But I was absolutely shocked at how there was no attempt to hide, to have a firewall between who was funding them and how they were hawking drugs. They were like, I don't know if I'm going to mention names or not because I don't want to be sued, but these top doctors, psychiatrists, were saying, well, Seroquel and possibly the other antipsychotics, certainly the SSRIs, were the answer to PTSD. I mean, what? And they're paid, and they're in military posts. So I became angry. I wrote, that in my book.
Before we, I was going to say, before we
I
started, recording, when we were talking earlier, you mentioned how, your attitude sort of towards the military over time has shifted, and how you met with some families and started to come to the forefront in your mind about all the medications that were being used. You want to share a bit about how that started?
Well, of course. So I got some phone calls from military Gold Star families in West Virginia. I went out there to interview them. And one lady in particular, she was a mom, a bereaved mom whose son had died. brought just a shoebox of drugs. And she said, if they just come in the mail, they don't examine him. They don't diagnose him. It's almost like they're a supplier for big pharma, and some of the deceased soldiers were suicides, but a lot of them were really victims of drug cocktails. That they've been given Seroquel and SSRIs, and maybe they use street drugs, and they die. So there was a lot of obviously over medication of our troops, and I felt too. I've changed my feeling a lot about the military because I feel like they're underdogs. Okay, now I personally lived near Great Lakes Naval Academy, and it used to be Fort Sheridan. It's not there now, but when you really look at our guys, you look at them on the train or coming into the city. These are not bullies. These are not winners in life. These guys are trying to make a living, And one thing that I found very heartbreaking to me was how many of our Iraq or Afghanistani soldiers went over there just to send money back to their families. Okay, I mean, these are not, the 1%. So I began becoming more sympathetic to the plight, of our enlisted people, and also their families, and also the result of the wars. And I attended quite a few support groups, not run by the government, but run by like peer support groups, where which really help because they help. They've been there, and I was just shocked at how a lot of our guys and gals, they were never the same. They talked about, like, one guy I interviewed a lot. I was there about a week. One guy talked about, even now in the States, he drives down the highway and he sees something, he thinks it's an IED, it's going to explode, and then they watch their buddies blown up and turned into pink mist. And this one family I stayed with, they lost 2 sons. Okay, so this caused me to look at not just drug makers, who I always looked at anyway, but the government.
Well, the thing is, what do they? I mean, we've seen it from our point of view as docs taking care of these guys afterwards, and trying to finagle their health care and get them into the VA and follow that kind of thing. And I've heard some of the horror stories about the care, but you're right, as far as the mental health care, and this is a big issue across the nation, but what and I think people have talked about it, but what is being really done to take care of our veterans and the mental health crisis? And it's pathetic, and it gets people mad because we send all this money to other countries in aid, but we're not taking care of our own.
I'm gonna pump the brakes if I can right here. You don't want to promote a mental health crisis. Okay. And because there's a problem here. It's like, well, we got to get these guys seen. It's a mental health crisis. Well, then they get in, and then they get more quetiapine, more Seroquel, more SSRIs, right, which probably for a lot of these young guys that are in their 20s creates the mental health crisis. I mean, the SSRIs, when they're advertised on television, still have to tell you that it increases your risk of suicide, because it does. So we're giving these traumatized people, that's what it is. They're traumatized. They go to war and get traumatized. And then, now we have a mental health crisis. Oh, perfect. How are we going to solve the mental health crisis? With more drugs, which then perpetuates the mental health crisis. And it goes around and around. And what does it do? It kicks out a crap ton of money for pharma and for lobbying groups and all of this kind of stuff. Whereas there are things that appear to actually treat PTSD that no one wants to talk about, like MDMA counseling, psychedelic drug counseling. I listened to a guy on a podcast, was amazing. He had like a junior resident in a hospital, right? You can never say who gave you this note, wrote a note, slipped it to him when he was in the hospital. He goes out and finds this counselor, sees the counselor for 4 or 5 months, is entirely cured, is off of everything, isn't on any drugs. That is something that the military, with this huge cohort of PTSD patients, should be studying. But of course, they're not going to study it because you get treated for a few months and then you never take drugs again. It's not what the pharma industry wants.
So, well, let's talk about why the military wouldn't want that and how they're connected to pharma.
Well, that's exactly. That's why we're talking to Martha. It's like,
well, Tim, you're exactly right. The drugs cause and perpetuate trauma. It's not mental. You're right. You're absolutely right too. I get angry. There's this awful organization called NAMI. Are you familiar with it? National Alliance on Mental Illness. They want to call anxiety and depression mental illness. No, they're not. It's life. Okay.
Yep.
So this is not mental illness. It is trauma. Okay. And I know, talked to some of my interviewees out there who said that in the government-run support groups, one guy tried to say that he was bereaved about his friend, and they said, we don't talk about our dead buddies on Wednesdays. Okay, there is no normal support there. Okay, in answer to your question, what are they doing? They are getting a little better. In my recent article on Organic Consumers Association, one particular military figure says that the best treatment for a lot of this is peer-to-peer counseling because they've been there. Okay. Another thing I personally have studied and believe in is EMDR. If you're familiar with that, which is just eye movement to try to quiet the vagus
I've heard
nerve.
of that for PTSD, especially. I have heard of that. Yes. Go
but
ahead.
It's fascinating because the eye movement thing is used commonly in meditative, like when you're learning how to meditate, even in hypnosis, the counselor will get you to move. So there's some really interesting connection between this whole eye movement, brain function deal.
Right.
Well, it's medically proven to be effective, and I think what it does is it keeps their trauma from haunting them. It lets their brain accept that, yes, this did happen and I can deal with it. So in other words, when they try to go to sleep at night, because a lot of our guys, they can't sleep anymore. Okay. When they try to go to sleep, then here comes these bad memories, and the EMDR, or the vagus nerve and the eye movement, helps them to integrate, or let's say put those memories in a different part of their brain so that they can live with it. It doesn't haunt them. So they also have, they're getting better. I will say that. They now have a crisis line where anybody can call at any time. And so they're recognizing, let's say, they're part of making things worse. Okay. I haven't necessarily seen an article about less drugs because they're a profit center for drug makers, as we well know. But there is an awareness that these so-called PTSD drugs make it worse, not better. We know that. Okay, they drive people to suicide. I was going to talk about this at the end, but I'm just going to mention it now. The malaria drug Lariam.
Yep. Yeah, it's
with it?
terrible for depression.
Okay.
Horrible.
Well, they say it's very analogous to angel dust and PCP. Okay, so in other words, it brings out panic, disassociation. So many of our troops are on the malaria drugs. Do you remember? I think it was 2012. This Sergeant Bales he was in some obscure post in Afghanistan. He got out of his sleeping bag, went into a village and killed innocent villagers. He was on Lariam. And they admit it in his trial. And then back in, I think it was 2002, 4 soldiers killed their wives because they were on Lariam. They were in Virginia. 2 shot them, the wives, 1 stabbed her, and 1 strangled her. And again, the court case proved it was Lariam. Okay, so that's what we're giving troops, the Lariam. And they're safer drugs. So I had to mention that because it's the disassociative state where they don't even know who they are, what they're doing. They're panicked, they're this and that. And that Sergeant Bales, he's got life in prison. And it wasn't even his fault. I interviewed a poor lady. She was a girlfriend or a wife of a soldier. And she said that he came home from Iraq a different person. and they had to put him in the brig. He was so violent. And I said, ask him if they gave him Lariam. And she did ask him when she visited him, and they did. He became so violent. So that's a whole different issue, because that's not really psych drugs, but it's drugs that have a psychological effect.
Wow. So I'm sure some of our listeners maybe that aren't really familiar with how enlistment in the military goes, but they're thinking, okay, why is the military letting in these young 20-some-year-olds into whatever branch it may be? If they're on all this stuff, is it because they'll just take anybody? Is there a shortage? How there's such a dichotomy. And then we know on the other extreme, depending on what you're trying to do in the military, if there's any sniff of any small problem in your past from when you're 5 to 12, that you're not you're disqualified from certain things, and it's frustrating. So in your research, can you give us any of your thoughts or findings on how kids, I call them kids, but young men and women are getting in?
I have a lot. I have a lot of that made, because obviously I had to revisit all this information to do my new edition, and I discovered some really frightening stuff that relates to even your case with your son. So according to the CDC, who is obviously not, that's government, right? According to them, I think they said 87% of all, no, 71%, this is in my notes here, of potential recruits will be disqualified because of obesity, and because of, what's the other thing here, educational deficits and criminal records. But the main thing that we're looking at now, two factors that are making recruitment really difficult, which explains the drag queens that they're trying to get to recruit people. One is that so many of our young people now are overweight, okay? And we talk about the food. So many of them are on the drugs that also make them overweight. And so many of them also have no patriotism. They don't want to enlist. They don't love this country, and they don't want to get hurt. Well, isn't that kind of the definition of joining the military, that you might get hurt? But it says in my research here. Another factor. Here's another factor for you. When I was young, the GI Bill would maybe send you to college, and it had all these perks that made the military service look better. Well, now they say that the corporations match all of that, so there's no reason they would go GI
Starbucks,
Bill when they can go to
literally. I mean, that was the joke before, is you could go to Starbucks and they'd pay for your education. So what you're saying is that the pool to pick from is now dwindling because our youth are so unhealthy to begin with that a lot of them aren't even physically fit enough to be able to meet the minimum standards for the physical requirements. And we know, and a lot of people might not know this, but they've even dropped the requirements as far as how fast you have to do your run, how many push-ups and sit-ups you do. Women is always less than men, but they keep dropping the requirements for both. So we have a minimal pool to pick from, as well as the fact that you're right. A lot of people have seen what the military is doing, don't agree, don't want to be involved, don't want to come out the other side and be sort of left on their own with a crisis. So they're just declining to join because it's an option in this country. So now that you've got this pool left, they're just picking. I mean, they have no option but to pick from this.
But part of that I actually respect, because Martha, we've probably come from completely opposite political ends of the world, or at least of American politics. But now we're in almost entire, total agreement. So you sit there and you go, okay, so, our kids are 24 and 26 years old. So they were babies when the Iraq War started. And I was, about their age when the first Iraq War started. And then before that, there was the Vietnam War, and there was stuff in Serbia, and there was on and on. So you keep rewinding the tape, and you get back to Eisenhower in 1961, who talks about the military-industrial complex. And you go, well, he was 100% correct. And not only that, he was the most successful military person ever to be spawned in the United States. I mean, he was the supreme commander that
Good
helped
point.
win World War II. So you should listen to him when he talks about this. And so there's part of me where it's like, if we're going to keep fighting stupid wars that don't really defend the United States, then yeah, eventually 3-4 generations later, people are like flipping you the bird and telling you to screw yourself, because I'm not fighting out in the sand dunes for a country I can't find on a map for 20 years. I mean, we literally now have people that were at the start of that war, their own kids can go to the same war. Like, how in the name of common sense does that make any sense? How about we defend our own country, we build our military up to the point where no one wants to mess with us, and we leave that in the United States. We stop being the world police, and guess what? Everyone would want to be in the military then, because it would be a cool job where,
No, you're raising a great No, you raise a great point, Tim. I mean, why would they want to when we've been made a fool out of? And you're like, I totally agree with you, except for World War II, which I have some relatives who were there, and of course we were fighting
absolutely.
for the world, and for us. But I agree with you that the wind has come out of our sails a long time ago. And what I would like to see, which has lost me a lot of friends, is how about put our military on the border, our border, our Mexican border, I mean, instead of letting 18,000 trespassers come in every day and give them free food, free housing, free clothing, free medical care. I mean, don't get me started on that.
I mean, shouldn't we be protecting our own country and our own borders? And we're just letting that go. It's like a giant sieve, creating a lot of issues. From like we're saying, about political issues and financial issues and every issue,
fentanyl issues,
exactly.
and
then we're
spy
sending our
issues.
people, our men and women, you're right, to these other countries and getting involved in stuff that it's like it's never going to change.
If we could go over to these obscure places with drones and find a little spot and annihilate it, or whatever our technology does. We can't stop 18,000 people a day crossing our rivers and coming in here for free food and clothing and housing and medical care and transportation and legal representation. Our own homeless here in Chicago, we've got encampments of homeless people who wouldn't mind free food, free housing, so that's a whole different issue. We have to do a spot on that, because it as a taxpayer, it makes me really angry. Okay. Yeah, I had a friend that went for food stamps. He was the only Anglo there. Okay. I mean, what is going on? But anyway, getting back to Tim's point about the wars, I understand that it would be really hard to be patriotic. We haven't really been the heroes for a long, long time. I totally agree with that.
Well, yes. I mean, I have been listening to a lot of RFK Junior's podcasts, and I have yet to hear anyone more erudite on the historical context of what's going on with Ukraine, with Big Pharma, with all of this stuff. I mean, the guy he's not just, genius level IQ. He has lived this stuff in his own family, and he must read 7 hours a day. I don't know how he has time to do all this whitewater rafting and cycling and all these other things that he does, because his knowledge breadth is crazy. And you look at all these things, and these are, we are paying the price for decisions that we made 30 and 40 and 50 years ago, where we gave our national security away to intelligence agencies, and they've always ended up screwing us. Like, it's just crazy.
Well, no, you're absolutely right. And I had friends who were in Vietnam, and it was just ludicrous. Okay, you're standing in a rice paddy getting gangrene, and they had bubonic plague and everything else. And wait, what exactly are we here for? Okay. And then, I mean, I totally agree with morale. We're talking about morale and pride in this country. And yet, and Iraq, and I was talking to a friend recently about the Iraq and Afghanistan. Correct me if I'm wrong, okay? But I don't think either of them caused 9/11.
Yeah.
Well, no, but who did? That's the better question.
Right.
Who did? Where were the 9/11 hijackers from? They're from Saudi Arabia. Well, there's no way in hell we were going to attack Saudi Arabia. I mean, that was an American ally.
Right. Oh, thank you. That's exactly my point. And so I said it's the ultimate non sequitur. Okay, they bombed the World Trade Center. We attacked Saddam Hussein. So that was a non sequitur. But getting back to the military, I want to go back to
Absolutely.
the suicides, if you don't mind, because what we don't hear any longer, okay, is that the suicides are higher now than they were during those two wars among our active duty troops. You see, Tim, I can tell you haven't read that either, because they're burying all this news.
You hear that suicides
Okay,
in
so it
general,
says-
a lot of people are talking about that and are blaming it on what's happened in the last couple of years with the pandemic, which is a big factor. But when it comes to military, you're right, we're not hearing that.
Okay, so according to my notes here, there were more suicides in 2021 than any year since 9/11. Okay, according to Army Times, there's more suicide deaths among active duty troops in 2021 than since the Depression in the 1930s. We don't hear about it because everybody hates the military. Okay, what is going on here? And so I researched it, and I'm like, well, what's going on? I know that they're drugging everyone up. I know that. But the official answers that we get is, well, they're isolated. Some of our guys are up in the Arctic. It's dark all day. It's cold. We can't get mental health professionals out there.
Well, then
Nobody
all
mentions
of
the
Canadians
drugs,
would be
okay?
dead.
But
I mean,
Yeah, and
seriously.
instead they're
I can say that because we lived it.
Instead they're very friendly and say sorry for everything.
Yeah.
So
no, we have one guy. We had last year. We had 4 suicides. Let me look at my notes here. In the Arctic, we had 4 suicides of active soldiers in the Arctic, and we had 7 in Virginia. Nobody covered this, right? Because it's where there's smoke, there's fire. What's going on here? What's going on? And one guy in Virginia, he served on the USS George Washington, and he did speak to like NBC or one of the networks, and he said, we feel overworked and undervalued. And I'm sure that's true. But you know, where do the drugs fit into this? We don't even hear about it anymore. You know,
but that's an interesting quote. We feel overworked and undervalued, said virtually everyone that works for anybody. I mean,
yeah.
You know, it's not like ask any employee. Oh yeah, I feel totally valued and I'm never overworked. Come on.
My scientific or doctor brain is going and I like to play the devil's advocate. How do we correlate that the drugs are causing the problem, or it's just a symptom of the underlying medical condition of these people getting in anyway? That that you're letting in a lot of people with supposedly mental health illness because they're already on those medications. So are they at higher risk for suicide or psychotic breaks in behavior? And the fact that they're on those medications is correlation and not causation. And I mean, we might not know that because maybe they don't want to study it because they don't want to know, or maybe there's some hidden data in there. Do you know anything on that?
Well, you're absolutely right, May. I mean, we do not have the paper trail we had 10 years ago. Now, I'm a cynic, and I believe that these 2 doctors who had the PTSD centers stripped all their drug links. And I think for the same reason we don't hear about the drug links anymore. I know they're still going on because I'm sure you are both familiar with the APA, the American Psychiatric Association. Okay. And it had, while one of these doctors was still the director of the U.S. PTSD Center, he had at least 6 drug companies funding him. And now I found that I had a lot of digging to do to find that. But I think what you're getting at, May, is where do the drugs fit in? Do we have, sources? Do we have facts? I can't really find them yet. I think that I did read, and I'm not sure if this is true, it was one soldier's opinion that you cannot be on the drugs and enlist. You cannot be on an SSRI and enlist. That's what I read. But once you're in,
No, I think that's
Yes,
correct.
we
I
hear
think
that from sources as well. Once you're
I
in,
think May's assumption that these kids are coming in already on drugs is I don't think that that's the case, other than stimulants. I know that they've changed the rules on
well, okay.
ADHD because, again, it's a symptom of the society where every single person has ADHD. So, it's just this overdiagnosis, overprescription. No, you take a young boy who's 8 years old who doesn't like to sit still, and then he's too noisy in class, and you punish him by taking away recess. Oh,
Yeah.
that makes sense.
I just found it too. It does say it generally disqualifies anyone that is or has taken medication for mental illness within the last year.
Yeah, it does, right.
So
Which
there
is
you go.
reasonable because
They're
stuff gets
disqualifying for
overprescribed.
1 year.
Yeah.
There you go.
Have you heard of hyperbaric therapy?
If you want better circulation, oxygenation, or respiration,
Turn up the volume.
everyone appreciates the increased energy and clarity.
Athletes, say goodbye to those PRs because you're going to blast
So
them.
how does it work?
We load your body with oxygen.
That means
Less inflammation,
fewer allergies.
faster healing, and more.
Come see us, 1200 Executive Parkway.
You know, the Upside Down building.
Call us 541-636-3278.
That's 541-636-3278.
We have some incredible deals
Heal, build, and thrive
with New Leaf Hyperbarics.
Got air?
Okay, and Tim, you're absolutely right about the stimulants. When I was young, it was street drugs. Okay, and the ADHD thing is that's absolutely the case. But also, and correct me if I'm wrong, you guys are doctors, I'm not, but I believe some of the asthma drugs also have psychological side effects, and a lot of our troops are coming in now on asthma drugs. Okay, and that's permissible, and there's drugs that are not psych drugs, but they have psychological side effects. So the troops are coming in on those. Once they're in, they're being deluged. Like we looked earlier, 1 out of 6 of our soldiers, according to Military Times, is drugged up. So, but you're right, the causality versus the correlation, we don't know that. I do know that these 2 doctors who had they're still, what is it, Ralph Johnson, the others with the government. I know that they stripped their drug links, and I found them anyway. So they're still, funded. I mean, how can the government be funded by big, drug makers? And then, so there's a lot of questions about the role of drugs in these suicides. But I can say this is in 2021 we had 7 suicides among, and obviously we're not in Iraq and Afghanistan anymore. These they were on ships. They were just docked somewhere.
Well,
what is
we
going
know that.
on?
I mean, anyone can look it up very easily, but we know from just our connections and inside info that once you get in, I mean, you can get. There's other things that it's called a waiver, where a doctor will examine you and go, well, this condition's stable, so we will allow it, even though, you have been on medication in the past, but. So it's that 1 year, 12-month period, you haven't been on anything. Like I just looked up, can you get waivers for bipolar disorder? It says, yes, this is a report from 2017, but the USA Today reported that those with a history of self-mutilation, bipolar disorder, depression, and drug and alcohol abuse will still be allowed to get waivers to enlist. It doesn't say. So back to our point where I guess if you have a shortage, you have nobody wanting to enlist, you have physically unfit people, and it's like, we need bodies, let's do the minimum we can and then give them a waiver for these conditions, and then all hell breaks loose.
Yeah, but I think that there's a fundamental disconnect here, a fundamental assumption that's completely full of crap, which is, okay, we got them trained, we've invested money, everyone has these issues, but we'll be able to fix it. And I think that's the problem. It's the looking to pharma. Well, we'll be able to fix it
with a pill.
And if you look back, there's a tremendous book. I don't know if you read it. It's called Blitzed, and it's about drug use in the Third Reich. I would love to interview the author. It is
I did read it.
Spectacular, and
he
makes an unbelievably good argument that the only reason that the Nazis were able to take France was because they were doing 36-hour shifts of driving tanks because they were all on crystal meth. And they were clearly on crystal meth. But the reason they could move so quickly is they never had to sleep and they were really happy. And so they just kept cranking out the meth
Well,
until eventually their soldiers became psychotic because they were, methed out. And you just sit there, you go,
I did read.
what? Well, we've been doing the same thing, just in a different way.
Wow. Well, and you wonder too about how, I'm pro U.S. I'm pro defending the U.S. But we know that war crimes occur too, and you wonder about the role of these psychotic stimulant drugs in war crimes. I mean, what does this do their ethics go away? You wonder about that also. And Tim, how about this? Correct me if I'm wrong, but didn't the Japanese kamikazes, they were also on
I think
speed?
everyone was on. I mean, we
think
still
it has
use
to
it.
be.
We still use it in our Air Force pilots, which is not, I don't
Okay.
think is misprescribing. I mean, if you're going to fly a B-3 bomber, the stealth bomber B-2, I can't remember.
You're not
that,
taking M&Ms to keep you awake. You're going to take something
no,
else.
but it's a 2-man
Meaning
crew, and
candy.
and the plane is only allowed to take off and land from there's from a military base, I believe, an Air Force base, I believe, in Missouri. So they would fly to Iraq, do their sortie, and then fly all the way back. So I don't know, 30 hours or whatever it was.
You got to stay awake.
And you got to stay awake. So, okay, so you take a little bit of Adderall for a couple days, and then you get 3 or 4 days off. That's no big deal.
Yeah, you're not doing Starbucks. And
yeah, it wasn't what
Skittles
they
in
did
the-
with
in the plane.
Pervitin, crystal meth in World War II. They just fed an unlimited sort. I think they ordered. I think it was one of the German generals ordered 100 million doses for the invasion of France.
Yeah, I remember
I mean,
reading
a
that.
lot of people would probably be shocked to
I
even hear
remember.
you say that. I mean, they wouldn't even think that, an innocent sort of pilot doing a long flight like that has to take something, an upper, just to make it that duration. But I mean, it only goes to make sense. And so what I want to get into here, and what I'm wondering is, obviously we have this problem. There's all these mental health drugs being used. There, outside of the military, there's a lot of, outside of the military as well as in the military, there's this thinking that, yes, the pill is going to fix the problem when we're starting to maybe wake up a little bit and go, maybe they're causing a problem. It's not helpful. How much, though, do you want to link the big pharma to the Department of Defense and the military, and that they're in cahoots together? Or is that a stretch just to say physicians, medical practitioners of mental illness are just doing a bad job because they think a pill is going to fix the problem, versus there's incentive or reason to be using these drugs in the military? Do you know where I'm going with this?
Yeah, of course. Well, I think there's a lot of ignorance among
Yes.
general practitioners. And we know that. Okay, I do think it's a concerted agenda in the military, and the reason I say that is because I've studied it so deeply. Okay, and I found too many administrators in DOD and VA who are unabashed pharma consultants who are now hiding it. But I just found too many to say it's a coincidence. Okay, I think that from drug makers' perspective, here's this great cohort where you can sell a lot of drugs, right? And I've just seen too many links to make me believe it's not an agenda. I think it is an agenda.
I've read other books, and we know that, yes, whenever there's a big cohort of people like that, willing or unwilling participants, that stuff starts to happen. And I'm trying to remember what podcast or book I read, where people are coming out now and they're talking about all the experiments, the mind drug experiments done back in the 60s.
Oh, yeah.
70s.
Well, yeah. I mean,
and what was that? Gosh, there was that phenomenon happening. I'll think of it here in a minute, but they covered it a little bit, but where people were having, these not flashbacks, but weird kind of thoughts, these mind experiments, almost like they implant. The radio frequency devices that they were using, and it's almost like you hit a remote and you can control what's going on and how someone acts.
Well, that was the that was the CIA and
Right.
KGB's
But if
wet
they're doing
dream,
things
was
like
this
that-
idea that you could have somebody be perfectly normal and flick a switch or have a
With radio
sound or a
frequency.
radio frequency, and then you could, you could make
So
your.
if they're doing that, why wouldn't they be taking the most basic thing that we have, which is medications and pharmaceuticals, and be testing them and experimenting in that capacity? I mean, to me, it makes sense that it would be happening.
Well, and wasn't there? I'm sure both of you read about the
Yes.
Havana
Yes.
syndrome. Okay, and what they're talking about, and I haven't studied it much, is
Yes, that's what
energy
it was.
weapons. Okay,
That's
which
what
would
it
be like
was.
force fields, and that is like so spooky. I mean, I don't even want to
But,
know.
but
I mean,
that was what I was
I
trying to
just don't
think of.
wanna
Is
live.
that so if they're doing that, I mean, medications, prescriptions, the vaccines, we've talked about that even in a couple interviews back with Pete Chambers.
But and I want to get back to that because there's an unholy marriage with the DO. I mean, that's another little rabbit trail, but I think it's very important to discuss. No, but I think you're also discussing MKUltra, which is where they actually did consenting experiments on military and non-military people with LSD. The CIA did to see. I mean, this is all out in the open,
Right?
And so, Ken Casey, who the author who wrote Cuckoo's Nest and the what was it, the electric acid bus.
Kool-Aid
That was
acid
his thing.
test, right?
That's how he got introduced to LSD, because he was given it to. He was given it by the CIA in an experiment when he was an enlisted Army guy, and he's like, and
I
it's
did
just
not
like,
know that.
what? I mean, they literally would have the MKUltra stuff is so insane. They would have one-way glass and go into brothels, and the prostitute would pick up these unsuspecting guys, take them to the room, and then they'd be having a drink, and they would lace the guy's cocktail with LSD, and then some perverted CIA dude in the room next door would be watching to see what happened and how, if this was a potential mind control thing. And, no one was consented to this. This was the kind of stuff that went on. I mean, everybody knows about the Tuskegee experiment, not treating African American men who had syphilis with penicillin when penicillin had existed and was an effective treatment at that point. These kind of experiments have gone on in our country for decades, and to think that somehow magically it just doesn't happen anymore, I think is naive at best.
No, good point about bringing up Tuskegee, because that's very much
Tuskegee could still be going on.
Exactly.
And they had a whistleblower in 1972 that pulled the pin on the whole thing.
Well, have you guys studied the asthma drugs much?
Studied in what?
The asthma drugs. Well, there's obviously a whole different, many different types. But do you remember the long-acting beta agonists, the LABAs? Okay, and this goes maybe back 7 years, but they mostly kill Black people.
That I'm not familiar with.
No, there was an increase mortality with the certain inhalers, which didn't make sense. Like your breathing got better. Definitely, it opened up your lungs, but it didn't have any, as I recall, like there was no real mortality benefit. It just it relieved your symptoms, but it didn't.
Well, and there was a money benefit for Merck or whoever, but I remember very distinctly that there was a study they had to end it because the Black people were dying. They have more prone to asthma, and they were dying from these LABAs. Now they've got all these new asthma drugs. I haven't followed that, but again, it's like Tuskegee. It's like what do either of you watch TV?
Unfortunately, too much. Yes,
and I don't get the remote, so we watch what he watches. There you go.
So, but you know that there's many drug ads on, right? Okay, and the drug ads, in my opinion, as a critic, I think they're the most dangerous because they don't have a proven record. They're the most lucrative because they're under brand, under patent. And some of these are extreme drugs that nobody should be taking them. So, in answer to your question, could we be given drugs that are harming us? Yes, we absolutely could, because advertising works. I was in advertising for a long time myself, and it not just sells the drugs, of course,
Right.
but the
Well, we talked
diseases.
about that when you were on our
It
show
gives out.
last, remember? And we had Rick Dancer. We talked
Right,
about
right.
how we actually, Tim likes to pause the commercial and he will video or take a photo of that, the byline or the warnings at the bottom. And we made fun of it. We called it Funny Farm because of, the potential side effects, which they dumb down. And you explained how you get that, almost that bias where it's like, oh, well, it doesn't sound so bad. What do you call that phenomenon where, there's these potentially life-threatening illnesses, necrotizing fasciitis, death, cancer, but it's all soft played down and
Well, and because it's put next to
right,
pain
that's
injection
right.
site,
Yeah.
it's like, oh, yeah, I expect I'll have a bruise, but what's happened, in my profession, I'm a reporter, is a lot of stories will not get out because of the advertisers
Right.
on the news stations. Okay. And it's very apparent. I mean, even the thing we just talked about with the current military suicide, well, that's not an advertiser, but let's say with dangerous drugs that are like, I'm not a fan of the Humaras and the Enbrels and those. And the reason why is because that is a small percentage of the population that has RA or they have Crohn's disease. I'm not saying that they don't suffer. I'm not even saying that drugs don't work. I'm just saying that has been a moneymaker for Big Pharma. Okay. And so some of these drugs that they're now putting out there, you know, they're not they don't have a proven record of 10, 20 years. I always recall statins. Okay. They were the best selling drug in the world. Okay. And only when they went off patent did they say, oh, by the way, they have X, Y, and Z side effects. So there's a gap between a drug being on patent and hearing about like maybe they don't test them long enough. Like one thing, and we might have spoken about this before, the SSRIs cause osteoporosis. Okay. Well, they marketed them long before the long-term studies had revealed it, so there's, but in answer to what you're saying, the mind control, of course, I think there's, they've estimated a quarter of the population is on SSRIs. Okay. What does that do in terms of like our critical thinking?
Well, and now even talking with one of our good friends that is an expert in the gut microbiome, knowing that SSRIs can affect that you're, when they're thinking that the gut microbiome really is like the nidus for all of our, not all of our health, but it impacts it in such a massive, major way. If your gut's being destroyed by SSRIs so that your gut microbiome can't be healthy to then impact all the other downstream effects with your hormones and your neurologic system, etc., blood-brain barrier. I mean, that's another level from your bones to your gut to everywhere. And so,
and yeah, our friend Sabine Hazen, who is just an absolute delight as a human and an unbelievably good researcher and physician. She says like one of her mantras is immunity is in the gut. Most of your immune system is really modulated through your microbiome. And so what have we done in the last, 50 to 75 years? We've ramped up childhood vaccinations to the point where we're at like 72 or 75 shots by the time a kid is 15 years old. We give antibiotics like crazy. You come in and you get the sniffles and the patient's not happy unless they get a prescription. We've immunized and antibiotic and added hormones to the entire food supply. And then we wonder why we have rampant autoimmune disease, chronic disease, obesity, mental health.
So we're doing it on the general public side. Why would we expect anything different, if not worse, sort of on the military side where they have full control of what goes on in there?
So I want to ask a question. I heard of this and I don't know if it's true. I remember it from at least 20 years ago. I was talking to one of my colleagues, and this is, right when the Iraq war was ramping up, and we were, we still had that kind of surge of patriotism and people were running over and enlisting, where, they started to see this escalation of PTSD. So they started treating people with sertraline, Zoloft, as a prophylactic. And I have not seen written proof of that, but this was a like anecdotal discussion that one of my colleagues had with a soldier. It's like, yeah, no, they just give it to all of us because they know it's so damaging emotionally to be in these situations.
You're going to need this, right? Like a malaria drug. I have not heard that myself, Tim, but I would suspect yes, because you go to any general practice, and the first thing they want to diagnose, I mean, they're like M&Ms now, so I would not be surprised with that.
Well, if you get a hot
all.
flash, they don't want to give you, bioidentical hormones now, or suggest other alternative things. They want to. It's like, oh, take this.
No, take an SSRI for your
Paxil.
hot
Take
flashes.
this Paxil.
No, I encountered that last week.
Oh,
I saw a patient, and I'm like, I'm like, why are you? I mean, I love asking a patient, why are you taking a certain drug? That's because
they don't know,
because they either don't know, or it's given for some spurious reason. It's like, okay, well, I take that statin because I have high cholesterol. Okay, that kind of connects. That makes sense. But then I'll say, why are you on this SSRI? Well, because I was having hot flashes. And I'm like, excuse me? You know, it's not because you have an anxiety or depression disorder or whatever. No, I've had these hot flashes, and they're giving, and I'm like, well, I said, I might be ignorant. I don't know how that works.
Well, it does have that. We know this, that many drugs have multiple uses other than the ones they are initially indicated for. You find that out, and some are positive, some are negative. But just because Paxil stops the hot flashes doesn't mean it should be your first choice, because the potential side effects are so much more. That whoopee-doo if Paxil stops hot flashes. It's like saying, well, if I light my lawn on fire, then it kills the weeds.
But remember,
is that really the idea? Is to light the lawn on fire, which potentially could light my house on fire to get rid of weeds? I mean, so whoopee-doo, it does it, but that's not the best interest. Yeah,
it's overkill. No, I totally agree with you. And I don't know if either of you realize this, but the same thing is going on with animals and veterinarians. I keep parrots, okay, and they told me to put my parrot on gabapentin. I mean, I kid you not. It's like Big Pharma will find a profit center wherever they can.
We had a friend who years ago, had a dog that was acting out, and he told us that he actually was cheaper for him to get the prescription of Prozac for his dog through the pharmacy where we worked, but his dog was on Prozac, and I'm like, what is the world coming to?
Well, our dog was on Prozac and gabapentin, and then she ended up killing herself.
Yeah, she literally
walked out into the middle of a highway.
She was actually demented, and she
maybe it was Prozac dog suicide. Who knows?
Let's sue the company.
Anyway, but
honestly, so let's circle back
around. I want to talk a little bit about what Sasha Latipova has been talking about, and RFK has absolutely been banging the gong on this one, which is how the COVID vaccine rollout was actually a DoD op and not just this big pharma co-optation of government. And I mean, Sasha seems to have the receipts, and it's just like, holy cow. So then, you talk about how Big Pharma has infiltrated the military. They have, high-level advisors, people running departments that are obviously taking tons of money from Big Pharma. But I think it also works the other direction, which is the DoD was running all of these experiments. Even Malone, Paul Alexander, all these guys worked for the DoD, developing all this anti-biologic warfare stuff. All the gain of function concept came through biologic warfare funding. And then whoopsie, coronavirus escapes or whatever happens. And now they're caught with their pants down. So they already have research going on through the DoD for vaccines. And they just went to the drug companies and said, hey, you guys want to make a quick buck? Let's launch this, not this vaccine, not a medicine, a countermeasure.
Well, I can tell you this, Tim. I wrote a long piece about Operation Warp Speed for Organic Consumers Association and looked at all those things you're talking about. And I have to admit, I don't remember some of the specifics, but I do remember some of it, which was, of course, it was a military-led operation to develop those vaccines. I remember some bystander wanted to know why the entire U.S. health building was full of soldiers in fatigues. Okay. And many of the press people didn't understand why so many military players were involved in a health project. They had no health background. They were generals. And so you're right, there was a huge overlap and that a very underreported. I did study it, but frankly, I don't remember the specifics. But it was led. You're absolutely right. The vaccine effort was led by the military. Yes,
Well,
it was.
we remember interviewing Paul Alexander, and he was, as he was kind of being shown the door for saying lockdowns were dumb and we have to be really careful and keep our schools open because we're going to destroy a generation of kids. He was sitting outside the room because they escorted him out, and he said there was, I believe, a couple drug company executives doing the research, et cetera, and everyone else in the room was military.
Yeah.
And it was, he was just like,
no, you're absolutely.
What the hell's going on here?
And I will tell you, you probably read this yourself, the way that the military defended that is they said something that's it requires such urgency and is so widespread, only the military can handle it. That's what they would what they said, and that what they would have told you was this was too big for pharma, and there wasn't a precedent. And they cited the Manhattan Project. Do you remember that?
Right, the Manhattan Project. Yeah,
No,
sure.
I don't remember them citing it.
Right. That was where they created the H-bomb, right?
Right.
The atomic bomb. And they said it was like, okay, and they said this has to be a partnership between government and the military because lives are at stake. So that's how they defended it. And they even called it initially the Manhattan Project too when they developed the vaccine. I know Sasha did.
Wow.
I know she did a lot of very good reporting on that. And I didn't have her sources, but there was a huge ominous overlap. And one thing that I do remember about my article, and it hasn't run yet, was that an organization was delegated to oversee the pharma players that was not government, and it enabled a lot of hanky-panky. Okay, in other words, Pfizer, your direct overseer is not the government. It's this, private industry. So there was a lot of gray areas there that, it continued to this day. Okay. And I think what's happened, the last vaccine I had was to go to Africa for yellow fever. So I'm not a person that takes vaccines, but I think what we've got now is the nation has fallen in love with vaccines. This RSV thing.
I know.
It didn't exist.
So that's a bunny trail because I'm getting really depressed from this conversation now. But I want to know, are you going to start to do some reporting or anything on RSV vaccine? Because that's had a bad rap in the past. And
well, not a bad rap. The history of the RSV vaccine is absolutely horrific.
Well, that's what I mean. Okay.
So
horrific.
So I mean, I was going down this
choice of words.
I was going down this bunny trail 3 years ago. I just educated myself. I figured, I'm a doctor. I can read. So let me just read about this stuff, right? And so the RSV vaccine was originally developed in 1969. And RSV is a virus that is quite lethal, not super lethal, but definitely lethal for infants, for babies under 6 months of age.
Exactly.
For adults, it's a bad cold. So at any rate, they take the RSV vaccine, they develop it. It's like an inactivated traditional vaccine. They inject the kids, and they're just super ecstatic because we'll give this to newborns. They won't get RSV, end up in the ICU or die. And they get a great antibody response, and it looks fantastic. So they inject it into more babies, and then the babies get infected with native RSV, and the vaccinated kids die at a higher rate than the unvaccinated kids because of antibody dependent enhancement or some other immune, mechanism. So that was 54 years ago. So they're like, we just can't, it just doesn't work until now. So now by some magic fairy dust, unicorn farts, and
no one's come out to refute like why this is safer than the
right.
previous. That's what scares me.
But
They're
it's not
putting it
going to
on
be
TV.
safer.
It's like it's
Thank
on
you.
TV. It's like get your child vaccinated. It'll
No,
prevent them
no.
from
But they're
dying from
not.
RSV,
They're
but
not
they're
even
they're not
approving it
even.
for kids. It's not even directed at kids. That's the problem. If it was if
It's
it was an
adults,
RSV
right?
vaccine directed at infants, it might actually have a mortality benefit if it worked properly. But they're not doing that because they know they're going to kill
But
kids with this
adults,
damn
but
thing. They're giving it to adults.
What? So we don't.
It's a
get,
vaccine for a bad
so I
cold.
don't get croup when I talk. Like what we do.
No, well, but it's just
That's what I mean.
no, but it's completely nuts. Plus, so many people are already immune to RSV anyways because they had it when they were 10. I mean, it's completely nuts.
Well, no, you're absolutely right, Tim. But you're absolutely right, Tim. And I feel that that's because the whole nation has the drug makers have fallen in love with the vaccine cell. I read recently they now have a vaccine for menopause. Okay, because the country has fallen in love with vaccines, and so here comes, like you say, RSV, which doesn't, in my reading, affect adults. And
No,
what the
for
heck?
adults, it's usually laryngitis, a barky cough, if you get that, and
But
you've
this
got a
is
bad cold.
this is what people.
But the vaccine for menopause, I have heard of that as well. It's like, well, we can now prevent this from happening and just put you into permanent remission from your menopause, and it's frightening.
But here's the problem. The problem is they think that if they can literally put lipstick on the pig, that it will be pretty, and it won't be a bacon producer anymore.
Well, they haven't convinced the medical community, like people like us. It's like, well, why does this one work if the other one didn't?
Well, but that's the problem. Well, this one is sexier because this one uses mRNA. It doesn't matter. It's not the vector of the vaccine that matters. It's the virus you're vaccinating against. And some viruses are not amenable to vaccination. So common cold viruses like coronaviruses, like parainfluenza, like RSV, they're little tiny viruses that mutate very, very quickly. They're not amenable to vaccination. They're not smallpox. Well, they're not polio. That's the problem. But we're like, we eliminated smallpox with the vaccine. That's the byline. Therefore, take your AIDS vaccine. Oh, that's right. It doesn't work. We've tried that for the last 40 years and none of them work. They actually make you more susceptible to getting AIDS. Whoopsie daisy. That didn't work. It's not vaccination is very, very complicated, and we've simplified it. We're going to be, maybe we need a vaccine for dipshits and we'll just go to Washington and spray it in the air.
That might be the answer to all of this.
It's just.
But you know what I'm thinking, Tim, when you talk about that, all of those are critical thinking questions. And if you have a generation that's doped up on psych drugs, on antidepressants and whatnot, they're not thinking like that.
That's a perfect way to circle back to this. Look at what we're doing. We've got kids looking at social media, their phone, whatever's on the web, feeding their brains with info. I don't know that any of them watch TV anymore. It is all phones and computer and apps, and they're on all their TikTok. Well, there's some intelligence right there, right? And the dumbing down of our society in general through the lack of education, but then throw these meds on top of it. It's frightening. So I want to try to, I don't know, how do I get you to wrap this up in a positive way that gives us hope or even helps people open their eyes?
One thing I really do strongly suggest to anybody who has trauma, including soldiers, is EMDR because it's drug-free, it's cheap, it works quickly. Okay, so that's something very positive. Anybody can pursue that. It's not drug makers don't like it. It makes no money for big pharma. But I think there's, doctors like yourselves are having an effect. Speaking the truth, like what Tim said about the vaccines, that the medical community needs to sit up and listen to this type of thing. I hope you both do a book.
Well, speaking of writing, it just brought something to mind, and it's fascinating. I sent a text, and you're an artist yourself, so it was fascinating. I sent a text to a friend of mine, and I said it was about David Bowie basically predicting all of the stuff that's going on now, and I said, smart people don't listen to scientists. They listen to creatives, because in the mind of a creative is the mind of God. And so here is a heavy metal song by Megadeth from 2007. And it is absolutely prescient. The quiet war has begun with silent weapons, and the new slavery is to keep the people poor and stupid. How can there be any logic in biological
and
war?
fat.
We all know this is wrong, but the New World Order is beating down the door. Oh, something needs to be done. And then at the end, it's like, and it talks about how Washington is next, and essentially the writing on the wall is that Washington is next, and that's and then he goes on at the.
Can you find it?
Yeah. The world predicts my future and tells the truth about my past, of how the world's leaders are waiting to usher in the eighth world power of modern Rome. Washington is next. And it's just.
And that was what
2007.
Who's that?
Listen to this.
You're gonna have to
Listen
link
to
that
this
in the
line.
show notes.
Disengage. 2007. Okay. This is so crazy. This is almost 20 years old. Disengage their minds, sabotage their health, promote sex and war and violence in the kindergartens, blame the parents and teachers. It's their fault.
Oh.
Attack the church dynamic, attack the family, keep the public undisciplined till nothing left is sacred. And the have-nots get hooked and have to go to the haves to cop a fix. I am the king, an evil king who dreams the wickedest of dreams.
Whoa.
Holy crap.
Who is that?
That's
And who
Megadeth.
wrote
That's Dave
that?
Mustaine, an ex-drug addict.
What's the name of that song?
Washington is next. It
Ooh.
just like absolutely gives me chills. I must have listened to that song 500 times, and it just came to mind when we were talking.
It is prescient. It's absolutely prescient. And I've written like some of that, not so strong, but this idea that once you have somebody's brain, they're not skeptical. Okay, but this is much bigger. What you're saying, the health, the haves and have-nots, very, very interesting. I never heard that.
Well,
I never heard
Tim
that.
can fire you some more very insightful tunes that he listens to on the regular. But so, I mean, it is time to, we hope that this podcast and just interviewing you and with your expertise and background and research that you've done and your book coming out will help people wake up their eyes, and not just medical community, but people in general, so that they can start to question these things and say, this isn't obviously working. It's creating bigger problems. What are some alternatives? What can we do? And I think it's just one small step, but at least it's a start, and that's kind of our role in this. And we really appreciate what you do and on your side and research and writing about it. Why don't you tell our audience where your articles can be found as well that you write?
Surely, thank you. Well, I've been a contributor to Epic Times for about 17 years. I contribute to the Bobby Kennedy site, the Children's Health Defense. I contribute to Organic Consumers Association, which is their leader, who just unfortunately just passed away, but he wrote a book with Mercola about the whole vaccine thing. So he's I've written for Dr. Mercola forever. And so I'm but the book itself, which has so much in it, it's got 80 pages of source notes, because I won't write one word that isn't sourced. Okay. It's called Big Food, Big Pharma, Big Lies. And it covers not just this military stuff that we covered here, but the GMO foods, and what they're doing to the food. So it's worth it.
And people pre-order that now through Barnes & Noble? Awesome.
Yes, they can. It's
Perfect.
a Barnes & Noble. Yeah. It's a paperback. It's cheap. But anyway, thank you both for the good work you're doing. My gosh, I'm so impressed with how you've thought through some of these really kind of elusive questions. They're elusive. The media's not addressing them.
Well, media, I've lost all faith in media, sadly. I mean, years ago when I see, one side pit the other side, I'm like, I just want to hear some news about what's happening around the world, and it's all politics.
I haven't. And the reason I haven't is the way you combat this is not from the inside, it's from the outside. We're not going to go to Fox News or CNN or
not the
MSNBC and change these guys. They have a business model,
Right.
and they're going to
They're
stay with their
hopeless.
business model. The way you do it is like little schmucks like us continuing to beat the drum until there's 14 gazillion of us saying the same thing.
And back to reading and writing.
And-
People
and
writing
reading,
on,
yes.
Substack.
I mean,
and
Substack
articles
has-
like you're doing, and I'm going back old school. Forget what's out there on television or major networks. How about getting back to reading and writing some intellectual conversations and research articles?
I truly believe Substack is the Thomas Paine common sense leaflet of the 21st century.
In the last year, it's really become that. You're absolutely right, Tim. It's sort of like what we have against these brainwashed media, which they are hopeless, and not just because of who works there, but because of their advertisers and their boards. They're who. So I agree, and I don't have a Substack right now. I'm still waiting for sites, and I've got books coming out, but keep doing what you're
We are
doing.
plodding along, God willing, currently, and we're so happy to just connect again, have a conversation with you, and of course, we will continue to be in touch.
Oh, absolutely! I'm going to look at those episodes you mentioned as soon as we end this. So thank you both so much.
Thanks again for being here, Martha. MedicalExpertWitness.com's online program and coaching calls teach you how they grow dozens of thriving medical expert practices. Book a free call. Take the first step in achieving your medical expert witness goals with a free 30-minute call.
Don't miss out on the incredible opportunity to get your medical witness expert practice up and running. Visit medicalexpertwitness.com to sign up.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.